Good morning, everybody. With you, Professor Ghada Kazamel, cardiology consultant, National Heart Institute. And today we will speak about the heart failure in women. So the first question, does gender matter? Is there any difference between women and men? As we all know, we have a estrogen and estrogen cycle during our span of life. And during this span of life, the estrogen level is null, then increasing, steady, and then reduce. The difference between men and women, estrogen is changing during the lifetime. Despite of that, testosterone is nearby constant. So in our whole life, yes, there is a difference. As we know, women usually is very complicated in everything, even in their manner. They are more sensitive, they are more responding sometimes by overacting or not. You cannot guarantee their attitude. Men is simple and the key is only one key. Today we will go through a lot of problems, the scope of the problem, the etiology, the risk factors, the symptom, what we can do for prevention, for diagnosis and treatment of heart failure in women. We have a lot of dilemma, we have a lot of cardiovascular diseases in women. Cardiovascular diseases in women containing a lot of problem, arrhythmias, angina, valvular heart disease, cardiomyopathies, stroke, coronary artery disease, and the end of most of that is the heart failure. And when women enter in menopause, the risk for cardiovascular problem increase 2 times than the others premenopausal time. And also the rapid reduction of estrogen level at menopause lead to increase the LDL, which increase and reduce the HDL, and all this increase the risk of cardiovascular disease. As we all know that dyslipidemia is a main risk factor for atherosclerotic heart disease. Women have a higher mortality rate due to arrhythmias than men, and all in our practice usually notice that there is a lot of arrhythmias, whatever the type, BVCs, AF, flutter, SVT, the incidence is more common in women. Women have fatal arrhythmias as the first indicator for a cardiovascular disease more than men. So arrhythmia is a big issue, ischemia is a big issue, especially in women. Okay, what is the common cardiovascular disease? Women have a longer rate for corrected QT interval than men, and as we know, QT interval, prolonged QT interval is a key for a lot of arrhythmias. It has been determined that male who have long QT interval have a strong correlation with fatality, post-myocardial infarction. So, by the way, the female has more prolonged QT than men, so the risk for sudden death is more common in female. Okay, what is the scope of problem? In the lifetime risk of developing a coronary heart disease, 1 in 2 for men and 1 in 3 for women by the age of 40 have incidence for coronary artery disease, and women and men have equal life risk for developing heart failure at the age of 40. The lifetime risk for development of heart failure for both men and women is 1 in 5. So by a small calculation, if we have a 100 female, 1/5 of them will have heart failure in their life, and this is a very big number. Occurrence of heart failure increases with the advances of age, and usually for the good chance of women, they are more older than men, so more affection by cardiovascular disease and its aggressiveness than men. Unfortunately, despite of all that, we will find that heart failure clinical trial, women not presented by a big number. Despite in the whole world 50-50, men to women, we found that all the study not even exceeding the 30%, as the study merit trial, solved treatment, solved prevention, realis trial, dig trial, charm, valheft, all the percent of female, the maximum presentation of the female in the study not exceeding 32%. So till now we didn't have enough study enrollment related to women. Towards the risk factors, there is a traditional risk factor which you all know about the cardiovascular disease, including diabetes, smoking, obesity, physical inactivity, hypertension, dyslipidemia. This is all present in men and women. But there is some risk factor completely unique for female. As preterm delivery, there is no men with delivery. Hypertensive disorder with pregnancy, eclampsia and preeclampsia, gestational diabetes, autoimmune disease, breast cancer and its treatment, depression, all this is related to female, is related to the problem of female. So there is a traditional risk factor. They are comparable, men and women. Despite of even this traditional risk factor, we found the disease is aggressive in women, like diabetes. The incidence of diabetes is greater in women. The complication is greater in women. Smoking affecting, despite the number of female is less than male, but the smoking itself lead to more strong affection of the coronary of female more than male. Obesity and overweight is very common in female. It is maybe related to the physical inactivity or even the culture. Some countries and some ethnic find that the pretty in obese and not in thin. Hypertension incidence and dyslipidemia is very aggressive in female. Despite of all that, we find that there is other risk factor which is related to the gender itself. It is related to the pregnancy sequelae. It is related to some disease is more prevalence in female. So like the autoimmune, like breast cancer, like the hazards of the treatment of the breast cancer. And all that we find the emotional stress and depression, the incidence is more in female and more aggressiveness and more related to the cardiovascular disease. If we look to the etiology of heart failure in women, we found that hypertension is the first, and after that the valvular heart disease present more common in female, especially it is related to some autoimmune disease, it is related to some collagen disease, it is related to the non-specific cure in some countries related to the valvular heart disease in women. Incidence of diabetes, it is one of the major etiology of heart failure. There is now a slogan of diabetic heart failure, and also the coronary heart disease. Women usually has more aggressiveness of the disease. In relation to all that, women with heart failure with preserved ejection fraction are likely to have coronary artery disease and more likely to have hypertension. However, once the patient developed, the female patient developed coronary artery disease, it is a higher risk for heart failure than in male. The etiology of heart failure in women specific in women, usually related to the peripartum cardiomyopathy, the incidence of pregnancy, the incidence of perporium and the changes which occur during, which may be due to hormonal change, which may be related to many multifactorial. Till now, we didn't know what is the exact cause. All is theory, but it is related to the perporium, the third trimester and the after delivery for 3 to 6 months. This is era very specific for female. The autoimmune disorders, the collagen vascular disease and its problem, cardiotoxicity, like the chemotherapy, which intake as a treatment of a cancer breast, female is more sensitive for alcohol and other toxins, which may induce a heart failure by smaller dose than in men. There is a many genetic cardiomyopathies in selective population and in some genes and in some families and in female. Also, the viral myocarditis, the strength and problem in the viral myocarditis is more strength and aggressive in female than in male. Cardiomyopathies induced by tachycardia. We find a lot, we said before, tachyarrhythmias, SVT, AF, more common in female. And also it can produce cardiomyopathy related to these arrhythmias is more longer and much than in male. So the cardiomyopathy induced by tachyarrhythmias and stress-induced cardiomyopathy usually present in female, despite it is reversible, so it is better on the long run, but the incidence is more. And most of us know about Takotsubo and the depression which can cause a cardiomyopathy in female. Thank God it is reversible, and on long term it is better in prognosis, but the incidence is more common. Okay, how we can present and how can precipitate the etiology. Emotional stress documented to be the main driver in women to produce cardiovascular disease. Despite of that, men, the stress and trauma, it's the usual cause of heart failure in men. So female is a very fine and very fragile character. So the catecholamines and the can affect them more and more, and the graves and the emotional stress can produce a huge problem, and it is one of the main cause of heart failure in women. If we look to a risk factor which is related to hormonal change, we can found that in trial, which is a HERS trial, it is a heart and estrogen progesterone replacement study. We find a 9 factor were independently associated with the development of heart failure in women. We found that the atrial fibrillation, history of myocardial infarction, creatinine clearance less than 40 milliliter per minute, systolic blood pressure more than 120 millimeter mercury, active smoking, body mass index more than 35 kg per meter square, left bundle branch block, left ventricular hypertrophy, diabetes, which was the strongest risk factor for development of heart failure. So, despite of all risk, despite of all problem, despite of the same risk factor in men and women, we find this 9 character which is present more common in female and can predict and associated with development of heart failure. To compare men to women, there is a change in heart and change of heart failure related to heart. Unique anatomy and physiology which are present. As we know, the left ventricular mass is lower in female than in male. The contractility is greater and preserved in female more in male. So most of our female with diastolic heart failure, not with systolic heart failure. Left ventricular mass is lower in female. Apoptosis and cell death is lower in women than in men. Coronary artery disease caliper is smaller in female than in male, and we usually say that when you see a small caliper coronary territory, we say that it is a feminine small caliper. it is a feminine. So small caliper usually take slogan of female character. So usually the coronary vessels caliper is smaller in female than in male. Blood pressure tend to become lower. Resting heart rate is higher in female because usually female is not tolerating a lot of catecholamine, a lot of stress, which making heart rate is higher. And all this lead to increasing heart rate, which one of independent risk factor for heart failure and even mortality. So there is a lot of problems related to a female and its effect to the physiological feature and anatomical feature. Related to catecholamine mediated vasoconstriction, it is less in female. To say that is female has which type of heart failure, diastolic or systolic, and or by the other definition, heart failure with preserved ejection fraction is more common, or heart failure with reduced ejection fraction. Diastolic heart failure or heart failure with preserved systolic function is more frequent in female. Women develop diastolic heart failure more frequently than systolic heart failure. The ventricle becomes stiff, not take its time to relax properly, and this lead to all manifestation of heart failure, pressure rising in the heart and lung, and even generalized anasarca, shortness of breath, and all these symptom and manifestation. Related to systolic heart failure, which occur when the heart is become weak and cannot contract properly and cannot conduct or pump blood by appropriate way, which lead to stagnation of the blood in the lung and then in the periphery, which lead to the manifestation of heart failure. So female has both systolic and diastolic, has stiffness, so cannot relax, or weakened, cannot pump. Despite the diastolic heart failure is more common, but the systolic heart failure is more aggressive in female. Related to symptoms, this is another issue and another problem, as usually the female is, as we said, more complicated. Usually they direct you by symptom to another disease and a lot of problem. Women tend to develop heart failure at older age compared to men, and usually in older age you cannot precise the symptom. The symptoms start to become vague, and usually you need to analyze a lot of symptoms to pick up the most common manifestation of heart failure. Heart failure with preserved ejection fraction is more common and in men, as we said before, and heart failure with preserved ejection fraction account for at least half of the cases of heart failure in women. And usually we're doing a echocardiography and we say, she has a preserved ejection fraction, why she is all the time complaining? And the complaint is not related to the heart failure. When men and women with heart failure and low ejection fraction are compared together, women more symptomatic and actually higher mortality. She has a poor outcome. Women have higher frequent rate of shortness of breath, and unfortunately usually the main problem of the female is shortness of breath, and sometimes you cannot say it is related to a cardiac problem because it is a common symptom. She's complaining from shortness of breath even if she has a tight shoes. Okay, what is the relation between tight shoes and shortness of breath? It is a common symptom of the female, whatever the cause, whatever the agony. She said that I cannot take my breathing, I cannot breathe easily. So women have a higher frequent rate of dyspnea on exertion, difficulty in exercising, and lower limb edema. Women tend to have a worse quality of life than men for intermediate activity, daily activity, and social activity. Usually women like to talk a lot, but we didn't like to exercise. And when we found that a female on regular exercise, we say that, oh wow, she can do a lot of exercise. And at the same time, you are sitting in the couch, drinking sweetie juice and watching TV. Depression is also very common in women with heart failure, and sometimes depression is the clue of the heart failure, because she cannot do any activity and she feels that she is in a prison. She is inside home between the four walls. She cannot communicate with others and she's depressed. And we found that this depression due to she cannot do any effort, and it is a clue of heart failure. Women usually present with heart failure older age, more frequently develop left bundle branch block on ECG, and it is a very common finding in the ECG to more than in men, sometimes due to silent MI, or some due to just presentation of left bundle branch block. And left bundle branch block is pathological finding, and its presence alone increase the incidence for heart failure and even for death. So what are the symptoms? Usually she's shouting, I feel I'm not okay. Okay, what is meant by you are not okay? I'm not okay. Chest discomfort more than pain, upper body discomfort, I feel pain here, 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 here. Okay, where is the pain? It is not maybe the typical form, retrosternal squeezing, radiated. No, in female, a typical manifestation is typical manifestation. There is a shortness of breath all the time. I feel I'm hunger for oxygen. She may be due to lack of fitness, but it may be due to heart failure. So we should to take care. Usually have excessive sweating. Usually have excessive sweating, and you directed it is lack of activity. It may be due to thyroid dysfunction. It may be, and it may be easy fatigability with cold sweating due to heart failure. Lightheadedness. All the female has headache and dizzy, and you cannot say this is due to heart failure. She's always complaining from lightheadedness and dizziness, and it is a very common symptom. It is not specific for heart failure. Nausea and vomiting, sense of fullness, sense of I have something here in my stomach, I'm not well. Usually unexpected fatigue, and commonly I feel I'm not well, I'm not like before. This is a common symptom which you find in female. What about treatment? How can we treat all this type of female with heart failure? Do we have a special test for diagnosis? The special test for diagnosis is to listen to the female carefully and to interrogate her properly to elicit any symptom related to cardiovascular problem, and then to select appropriate investigation for her, to start in a mathematical form, to start by a lab test, including the CBC. It may be due to anemia, you can differentiate. And also anemia may complicate the heart failure condition. So we should to start very, very simple by CBC, urea and creatinine, to assess the creatinine clearance. As a creatinine clearance, if it is low, it indicates heart failure and high mortality. It is a diagnostic and a prognostic. Pro-B and B, starting with X-ray, starting with echo. Echo is a very nice tool for diagnosis. Then if you couldn't elicit something, start with a dobutamine echo. Don't count on exercise test. Actually, the female couldn't do exercise test, and usually we find the result is equivocal, uncompleted. So don't bother your time and do a lot of expense in something will not give you a lot of data. You can go through a CT, MRI. You can ask for any investigation which is recommended in the guideline but try to tolerate. If the patient cannot tolerate exercise, don't push towards a test. She will pay for it and the result will not be satisfying to it. Related to treatment guideline, medical therapy show no difference in overall recommendation or contraindication by using ACE inhibitor or ARBs, except when the patient is pregnant. During pregnancy, ACE inhibitor and ARBs is contraindicated due to risk of birth defects. Related to beta blocker in patient with heart failure has a lot of beneficial results for survival and hospitalization in subgroup analysis of women. So beta blocker is highly recommended in women, especially women tend to have a higher heart rate, and the higher heart rate in heart failure equal a specific and independent risk factor for hospitalization and mortality. While the primary benefit of digoxin to decrease the hospitalization in women, especially if there is a heart failure with AF and it is indicated, women less benefit from the digitalis than men, and othermore, the risk of mortality is more in women than in men who use digoxin. Mineralocorticoid receptor antagonists are also beneficial in women. In related trials, the women had a significant survival benefit from the spironolactone, so it is one of a recommended drug in patients with heart failure. In multiple studies, eplerenone was used and tested in selected population, despite the number of the female is not that high, but it was a 1,918 women. Those women taking eplerenone has better survival and readmission to the hospital. So it has a benefit in the morbidity and in mortality. Combination of drug including hydralazine, isosorbide in patients with heart failure and renal impairment, they found that the symptom, especially in female with reduced ejection fraction and moderate to severe heart failure, they found that there is no significant difference between men and women related to this combination. So the female can got benefit from hydralazine isosorbide combination. We have a problem of CRT, which there is agreement for CRT can reduce the symptom and reduce the hospitalization and improve the quality of life and increase the survival in women with CRT. But we have problem that sometimes CRT is not equally offered to female. Maybe due to cost, maybe due to lack of support. I think we have in Egypt, there is no problem because also it is funded by governments, so there is equal share. If it is offered to them, they will have it. ICD therapy can prevent deaths and is recommended in men and women. Current criteria for matching a heart based on or a body weight, or blood type, and the issue of a lot of lower incidence of heart transplant offered in female, because female has a lot of problems. Maybe the body weight, maybe the inflammatory condition, maybe the matching of the heart. So the offered female to a heart transplant is lesser in chances than in men. There is other problem related to, even if the female has a cardiac transplant, the incidence of death after 1 year is higher in female. And another issue related to left ventricular assisted device, which is used to bridge the female to the time of the transplant. We found that there is a criteria for devices which are present in the market. They need a special body surface index, and the female may not have this criteria. Usually female, if they have a body surface index less than 1.5 meters square, or even if have the exact body surface index like more than 1.5 but have a small thoracic cage. This anatomical consideration may make the LV assisted device not offered for female, because the female will not be eligible for this. And hopefully in the new era of technology and development of the machine, they develop more assisted device can fit for the small thoracic cage. Lipid lowering agent have a very beneficial effect in females. So female with MI, whatever MI, acute coronary syndrome, stable ischemic heart disease, lipid lowering agent is very important and producing reduction of the stroke and mortality and morbidity compared to placebo. So lipid lowering agent should be given according to the recommendation of the guideline if the patient has a ischemic heart disease which may cause heart failure. Women have more side effect from antihypertensive drugs than in men, including the hyponatremia and hypokalemia, and maybe the hypokalemia is one of the issue of the arrhythmia. So usually patient is more sensitive for the side effect of the disease. Conclusion: women can present differently, so it needs more time to listen and analyze, and do worse when they present with heart failure. Women are referred less often to appropriate testing and the treatment. Women can have more complication from the treatment, but still to have a complication from treatment better than not receiving a treatment. Cardiovascular disease is a nice killer because it is an equal killer, and there is equal opportunity for both gender, men and women, to have the disease and to have the mortality. For that reason, we should treat them equally and not treat them by inferiority or by an unequal way. Special consideration should be taken for the very sensitive era in the life of the female, which including pregnancy and menopause, because of their related comorbidity and related disease. And thank you.